There are tons of misconceptions about mRNA vaccines. This technology has brought us out of the worst of the pandemic. Early trials of mRNA-based cancer vaccines are proving very promising. The mRNA vaccine platform won an actual Nobel Prize. But still, there are those who are determined to see a threat where there is none. Myth number 1. mRNA vaccines can change your DNA. This is simply impossible for a few good reasons. 1. mRNA and DNA are not compatible. They're written in a different code. You'd have to convert the mRNA into DNA through a process called reverse transcription, which needs enzymes that aren't present in the vaccine. 2. Location. DNA is housed in the cell's nucleus, and mRNA can't just get in there too. It's all very tightly controlled. And 3. The mRNA isn't even around long enough to do anything to your DNA, even if these other barriers weren't there. It gets broken down super quickly and just joins the rest of the cellular waste for disposal. Myth number 2. mRNA vaccines cause shedding. Shedding is when live virus particles can be spread by people who have recently been vaccinated, for example in respiratory droplets. It's a real thing, but it's also much less of a problem than many anti-vaxxers say it is. It only happens with live vaccines, which mRNA vaccines are not. It also rarely causes transmissible disease in unvaccinated people. Again, even if this were a realistic possibility, the mRNA is not hanging around long enough to be shed anywhere. It is true that the risk of shedding does sometimes form part of the calculation of switching a live vaccine for an inactivated one. That's partly why more people today receive inactivated polio vaccines rather than live ones. Myth number 3. mRNA vaccines are gene therapies in disguise. Gene therapy aims to replace, alter or repair mutated DNA to correct a genetic disease. We've already explained that mRNA isn't getting anywhere near your DNA, so it's definitely not a gene therapy. Take COVID vaccines, for example. Rather than injecting you with whole coronavirus particles or pieces of them, we instead give your cells instructions in the form of mRNA to make just isolated components of the virus for the immune system to respond to. For a brief window of time, cells in your body become COVID spike protein factories, no infection necessary. After this temporary production line winds down, you're left with an immune system that knows how to respond to the SARS-CoV-2 virus when you meet it in the wild. Myth number 4. mRNA vaccines are dangerous and don't work. No medical intervention is without risk. For any vaccine, drug or procedure, there are those who will have a bad reaction or side effects. We can have a serious conversation about this without drawing on false information to make our case. Scientists understand the theory of how mRNA vaccines work. They've performed extensive trials to show that this theory plays out in practice. All of that data has been considered by regulators, who have judged the mRNA vaccines available to us today as safe and effective. Now, hundreds of millions of doses of COVID vaccines have been given out, and there is still data coming out every year, reinforcing the message that they're safe and they work.